Welcome back to The Loop. We are bold and fresh look at our lives here in Kenya today. And today we are looking at the issue of men's health. We're also celebrating men and asking you if you're participating in the No Shave November campaign. So remember, if you are part of this campaign, you're not shaving your hair because you want to save that money to donate to cancer research, education and prevention, send us your picture. I've already started the conversation on my Twitter page and also on the K24 pages as well. Post a picture of your beard. We want to celebrate you, and also tell us the men in your lives that you are celebrating. So who are the men in your life you're celebrating? Again, who are the men in your life you're celebrating as we celebrate International Men's Day and stand in solidarity with No Shave November? Daktari, I read somewhere that there are 29 different types of prostate cancer. And there's somebody probably watching right now saying, "Iyo ni nini? Prostate iko wapi?" He's looking at his body and saying, "I've never seen that thing. You guys are making this story up."
So the prostate is actually a gland. It's called the prostate gland. And the prostate gland is actually important in men because the prostate gland basically is the one that produces actually prostatic fluid, which is what, when men have an ejaculation, that's where the fluid comes from. Okay. So basically you have the testicles or balls or whatever you want to call them, where actually the sperm or the seed is. And usually at the height of intimacy, then the sperm will usually move to the prostate.
Oh, then the prostate,
Then the prostate now produces a fluid, and that's why semen usually is about 5 to 7 mLs. The sperm are usually just floating in there. So the prostate gland is important because it produces the fluid. Basically the transporter of the sperm from the male sexual glands to the women's sexual glands.
Okay. You know, whenever you want men to pay attention, you talk about matters to do with sex.
Of course,
I'm very sure now people are paying attention.
What
is this thing?
And they're like,
Okay, so a man listening in right now and saying, okay, fine, now you've got my attention.
Yeah.
How do I know I have a problem with my prostate?
So basically, the prostate gland actually sits, we call it at the exit of your bladder. So when you take a pee, usually the prostate gland is located there. Now, how do you know you're starting to have prostate issues? Prostate issues will usually start coming in older men. Unlike testicular cancer, which tends to be predominantly in younger men, prostate cancer is a problem of older men. Usually, some of the subtle symptoms will usually be actually what we call a poor stream. So usually, you know, boys joke around when they are young, they can pee all the way up there. As you grow older,
you can write your name on the wall.
Yes, as you grow older, that ability tends to regress. And the cause of this is actually an enlarging prostate.
Ah.
Yes.
So if I go to the toilet and I have a very weak stream, like I can't...
But wait, what is weak?
Yeah, so I can't aim into the bowl or...
So basically a weak stream usually means you can't direct it anywhere. You usually have a stream that probably just falls in between your legs. So as men grow older, these are some of the changes that happen. From the age of about 40, the prostate gland starts to enlarge. By the time most men around 60, 65, they actually start having symptoms of poor stream. The other thing is they may have dribbling. So basically, they go to pee, they try and pee, they think they're done, they zip up, and when they're walking out, pee comes out. So they wet their pants, and then sometimes they may have what we call frequency. So they go to the toilet a lot. So maybe at night, usually it would be more subtle, especially at night, because most people probably wake up once or they do not wake up at all. And then now you find this 60-year-old man waking up 3-4 times at night to go and actually...
But do I have to be like 40? Can I be, can that occur in younger, in like your late 20s into your 30s?
It may happen. Maybe my colleague can talk about this. It may happen, and it tends to be very aggressive if it happens in a younger person.
Yeah, and also younger people, if maybe they have similar symptoms, it could be an infective condition. So we call it urinary tract infection or UTI. So they'll have frequency going to the toilet to pass water many times, feeling pain on passing water, and you may have a discharge.
Is it hereditary?
So that's something else.
Yeah,
if
you're
younger,
something,
it's typically something else.
Because we see prostate cancer in men who are over 40 years.
That was my next question.
Yeah.
So how frequently should men get tested? And then what is this test? Because many men are scared of being told to bend over at doctor's table. It used to be like that.
I mean, yeah, so it's pretty invasive.
Yes, it is.
Yeah.
So ideally what happens is after the age of 40, as part of men's health, which I'm a big advocate for, they should actually have a prostate check. Now the prostate check, what you ideally would usually do is a blood test, which you call the prostate-specific antigen. It's a blood test that we usually do. And if it is elevated for one reason or another, then we should subject you to what you call a digital rectal exam to check for the prostate.
That's the one men are scared of.
That's the one men are scared of. But
okay, but first the blood test.
But first the blood test.
Dr. Catherine, how frequently should you have the blood test after 40?
Okay.
And how much is it? Because we're all worried about money.
By the way, it's not expensive. It's about 3,000, but it depends on where you go. Currently, when we follow the National Cancer Screening Guidelines, they don't recommend mass screening of men, but they encourage men who are above 40 years to have a candid discussion with their doctors. So the doctor will check through, maybe take history, try to identify end risk factors, discuss with you what tests do they do for screening of the cancer, and then the pros and cons of everything. Then once you agree, you go for the screening test. As we said, it's a blood test, and together you may have to have a digital rectal examination. And the frequency is higher when you are above 50 years.
Okay, so maybe annually or every 2 years?
At least annually, you need to be checked.
Can I ask, is it hereditary?
Yes, prostate cancer can run in families. And there are other risk factors apart from hereditary. We have what you call the prostate cancer gene, which runs in families. It could be also because of age. We know that 2/3, 70% of prostate cancer is reported in men who are above 60 years old.
Diet?
Because
I know that men are watching, waiting for you to say meat causes this thing, and you're about to cause the nation to go into a panic.
Not really, not really.
Okay.
Actually, age is number one.
Okay.
Yeah, then being an African, black race, it also increases the
we're more
risk.
susceptible to prostate cancer? Okay.
We are more
Really?
susceptible than
that.
even the Indians. In fact, we rarely report prostate cancer in the Indian generation. Rare.
Caucasians,
And even,
That's actually interesting. So I was reading somewhere that men are more likely to die with prostate cancer than of it. But is that true of African men? Because the research, it was online, so I'm assuming it was Caucasian based.
No, it is true.
So it's not
true.
a deadly killer.
It is, in fact, it's a silent disease, and many men will die with it and not of it.
Okay.
But it depends on the
reassuring.
aggressiveness. After the doctor makes the diagnosis, there are some cancers of the prostate which are aggressive, others are not. And if the doctor feels your cancer is not aggressive, they will not even give you treatment. They will just recommend regular checkup, because some cancer doesn't cause problem.
Okay, so there's probably somebody watching now saying, kama hiyo kitu imeleta shida hivyo si uitoe.
Yes, so in men who have difficulties, especially with passing urine, then sometimes that could be something to consider. Ideally, we would start with what we call medicines. There are now medicines that can actually try and shrink your prostate. But that has to be done, of course, in consultation with your doctor. They've checked that your risks for the cancer are low. And then at that point in time, if the medications to shrink the prostate are not working well, usually between 3 to 6 months. If the patient still is exhibiting symptoms, then at that point in time, they might need to do what you call a prostatectomy, removing the whole prostate, so that it enables them to actually be able to pass urine quite comfortably.
Does that affect performance?
There've been a lot of advances in terms of how the prostate is removed. So basically nowadays with the minimally invasive techniques, then the likelihood of having a lot of side effects after that are actually minimized.
Oh, good to know, good to know. You mentioned testicular cancer, and you said it's a younger man's disease. What is it? Where does it come from? And also I read it has a very high survival rate. So how does a man even test himself, or what is it?
So for testicular cancer, probably this probably would now go down. Prostate cancer, you think you're talking about men above the age of 60. Testicular cancer is now around the age of 20. That basically, the age of 20. Sometimes probably even slightly younger, but most of the time around men in their 20s. And basically, it would start off as probably a lump. Just like for women, they have a breast lump. Testicular cancer would be the same. It starts probably just as a lump, and then it grows slowly.
Is it common?
It is not very common.
No, it's not common.
It's
It's,
not very
actually rare.
Oh.
And men are actually encouraged to check their balls almost monthly. The way women, we examine our breasts every month, even men should start feeling the balls.
So partners should also
For
help
lumps.
each other out.
we actually recommend that. We actually recommend that. It's actually been, the studies have actually shown that for testicular and for breast cancer, that it's actually the spouse who actually discovered.
You know, it sounds funny,
Because
but
your
your
spouse
partner
probably knows you
probably
better
sees
than
you
Yeah.
and sees
No, but
those
for breast
parts
cancer
of
as
you
well, I'm sure,
more
like, you know,
critically
men-
than you do. You
Yes.
probably dress yourself and go.
Yeah. So yeah, I think we're calling on spouses to be a bit more vigilant as you're becoming, as you engage in intimacy.
Especially if your man is in his 20s.
Pay a bit of attention. You might just be saving your spouse or your
Okay.
partner.
Beyonce's dad made breast cancer famous. A little while ago, he came out and said he had breast cancer. Is that, are we seeing cases of that in Kenya?
Breast cancer is actually one of the most common cancers in women, but about 1% occurs in men.
Oh.
Yes. Yeah.
Okay.
Okay.
All right.
So again, men should be looking for lumps.
Definitely, and you know, men have less breast tissue, but they have a breast, so they are at risk of getting breast cancer. And if they notice any lump, they should report to the doctor, because the amount of breast tissue is so small, and if the lump is there, it can spread quickly.
Oh, very quickly. So it can be
Yes.
very aggressive.
In fact, it can be diagnosed at a late stage if the man ignores.
What are the risk factors for that? Is it also hereditary, as Mike was asking?
Hereditary is one risk factor, age, and then sometimes it could also use of tobacco.
So tobacco all around,
All
not a
around.
good idea.
Yeah, and even a positive family history.
Yeah.
In your family.
Okay, so I think we've got quite a bit of feedback. Let's see what
The men we're celebrating.
the men we're celebrating are saying here. And so what we asked is for you to send us, you know, a picture of your beard if you're celebrating No Shave November and standing in solidarity with this great campaign. But we also want to know, who are you celebrating? Which man in your life are you celebrating? That's me celebrating myself there. But
That is a
I started the trend. So I started a trend for, you know, men and their beards. And this is a heavy dog, David Akalimon, there with his very healthy beard.
That's a beautiful beard.
Yeah. For us who've got patchy ones, that's just a dream.
Pressure.
And Eric Mwenda there looks like he's outside his Kaduka, also standing in solidarity with the No Shave November campaign. And I'm loving this, you know, like, you know, men are aware about what this campaign is about. Here's another man, Kenneth of Bok. Kenneth, thank you so much for sending in your picture. Also celebrating here with his beard. And remember, we're asking you, which men are you celebrating in your life? And we're asking you to also send us pictures of your beard, send us pictures of, you know, the men you're also celebrating, and tell us why you're celebrating them. Here is a gentleman saying, no shave on November. I'm celebrating the kind of men who can put food, shelter, and clothing to their families. That's a Robo from LD.
Go,
thank you so much, brother. As he's also, you know, his beard game is also quite good there. Another gentleman here says, K24 The Loop, men's health awareness, heartfelt appreciations for the talk. I celebrate these great men, Mr. Edward Mutiga Matiri, Mr. Joseph Wanderi, and Mr. Edwin Mugendi Ndwiga, Jonah from Nairobi. We celebrate those
Nice
gentlemen
beard
there
and
with
a
you, and
bald
there's his
head.
beard. If you don't have a beard, it's okay. You can send us a picture of maybe hair on your armpits or something. Celebrating my dad, Benson Dugere Gishohi, akiwa Karen, and that is Nixon Buru wa Ndugire kutoka Kindaruma. Thank you so much for that picture. And
like
Sir Nixon
that,
is there
the-
with his beard. Really healthy one.
The salt and pepper.
Here's another picture. Another man celebrating the No Shave November campaign, standing in solidarity with that campaign. And this gentleman here says, The Loop, hashtag No Shave November, Movember, more awareness of men's health, especially cancer, is needed. James Muigai from Joro, celebrating myself, men tujipende pia. There you go. Congratulations to you for having a full healthy one. Here's another gentleman sending us, this one was at night, sending us his beard. Still proud, we can still see it. Thank you for that. Here's another gentleman saying, celebrating my great man.
I think that's from a woman celebrating her man.
Oh, celebrating my great, oh, that's, yeah, well.
Yes, celebrating her
Very good.
man.
Yeah.
Well done. Well done. I love that response with the salt and pepper beard.
Yeah.
I see men also have beard envy. So that guy with the full beard, both of you are feeling something.
No, it's okay. There's no pressure. There's no pressure. But since we're talking about men's health, and you know, I mean, cancer is definitely an issue. But there are other health issues that men face.
Yes.
You know, and I think one of the things I see men face the most, because a lot, you know, men have a lot of burden placed on them by society, by family, by culture, tradition, religion. You're the breadwinner, you're everything, you know. And so that stress that men carry, and because men don't talk about the issues that they face, men don't go to hospital, you know, misi adange hospital, nitakunywa tu chai, you know, like you've got all these things that we say. And so we are very prone to stress, high blood pressure, those sorts of, you know, diseases as well. And then, you know, kidney complications and kidney failure. You have a lot of men going for dialysis. What are the other health complications that men face?
So Movember was actually a movement that was started with regards to men's health, not only for prostate cancer, testicular cancer, but also for suicide. That actually men are more afflicted with regards to suicide, or are more successful with regards to suicide across the globe. So suicide is a problem, especially in men, and suicide of course touches on the psychological well-being of men. As you've mentioned, lots of stresses. Men have lots of pressure to perform, pressure to succeed, pressure to be a parent, a husband, a good son to their parents, a provider, all that. So there's immense pressure on a man to try and actually perform. And that's why for men, performance is actually usually like their ruler. Okay? I mean, a man has to measure himself amongst his colleagues. He has to measure himself with his dad. Lots of pressure, and sometimes that can get to a man. But men need to look for healthier ways to actually diffuse the tension that tends to occur. And
go to the bar.
Yeah, of course, going to the bar.
Should they punch something instead? Like
but as Dr. Nyongesa would tell you, also drinking copious amount of alcohol will put you at risk for esophageal cancer, you know, stomach cancer because of too much alcohol. So some of the behaviors that men also tend to take out their stresses on sometimes are not healthy. Women will do what? Have a cup of tea, cry. Are you getting me? It will not harm anyone, okay? And you felt like you vented out. So for men, we need to have forum for men to be able to actually vent out, men to be able to talk. There's a friend of mine actually with him in high school. He has actually started a series on YouTube where he actually discusses men's issues. Just purely men's problems only.
How does that work? Because I run a forum for women, and I've been challenged to start one for men, but I don't feel like men speak in the same way women do. I believe men speak around an activity.
Precisely.
Is that true?
Precisely, precisely. Okay. You've hit the nail on the head. For you to get men, you need an activity. So, for example, if you talk about football, okay, most men will show up. If you talk about wrestling, men will show up. So when there is an activity involved, then the men will usually be able to, you know, open up a little bit better. Rather than, you know, let's sit and chat, let's have a tea party. That's not going to get any man talking. Okay, you want to have an activity. So they can go, I mean, we used to go cat racing with my friends. So as we are busy trying to race and beat each other, of course, we discuss about the stresses that we have. Or when I'm playing maybe Sunday basketball, something like that, then we can discuss the stresses that we have.
Okay. Regarding the mental health, how well do men cope compared with women when it comes to dealing with these heavy physiological health issues, cancer, high blood pressure, or diabetes? How do men cope?
Yeah, it's not easy, but they can cope better when they also have a family support. They need a social network. They need people they can always talk to. I'm sure in the society they'll always find someone. And also if one finds they are overwhelmed, they need to see a counselor or seek professional advice. Okay. Because they break down and you cannot just suck it in. Yes. I think it is always good to face it and get psychological help. And maybe just to take us back about those symptoms we talked about for prostate cancer, men also in that midlife, they also get a benign prostate hypertrophy. And the symptoms are similar to those of cancer, urine getting stuck, a poor urine stream.
Hypertrophy means it's grown too much.
It is grown too much and it's not cancerous. And that happens to a lot of men. So they should not worry when they have those symptoms. Most likely it could just be a big prostate which will go away with the medication. But if it is a cancerous prostate, that's now when you will move to the next step.
Okay, okay. So you'd encourage men to get a support system. Are there support groups? Are there cancer support groups? Men's health support groups?
Yeah, like say we, at Kenyatta Hospital, we have what is called the Prostate Cancer Navigation Program. And men with prostate cancer from all walks of life can come and join that group, and they talk about their challenges, their sexual issues, side effects of treatment. So there is support available in the society. Though not many men will come out and want to speak openly.
But what could we say to men who are watching right now about, even if you may not want to like reach out to a professional, you have friends in your circles. How do we begin to, you know, for men to be able to see that there's nothing wrong with being vulnerable and talking about the challenges and the pressures that you're facing?
So one thing about being a man is the issue about performance. And the reason why I said this is, as men grow older, you'll notice that men tend to be solitary in their activities. Women tend to do lots of things together. And case in point, just look at women and men over the age of 60. You'll always find the women in groups. You'll always find your mother or your grandmother, she always has her women's group. But you'll find for your grandfather or your dad, it's not the same. So men tend to be a bit solitary, and it's that issue of being a bit performing. So you're always trying either to outdo your friends or outdo your colleagues.
Or your dad.
Or your dad and something like that. So that gets into you. I mean, you're not going to be friends with somebody you're trying to beat. And that tends to isolate men somehow, that actually you're very successful, but you don't have so many friends because you're in that rat race trying to outwin everybody. Yes, you come out victorious, but you're alone. And one of the things that as men we need to realize is a man is only as good as his social network. I get me. As you grow older,
a man is only as good as his social network.
As a man grows older, his social worth is what's much more important rather than his net worth. Okay?
A social...
Yeah, your social worth.
I feel like you need...
It's true, no,
like there's a hard-hitting fact I'm going to ask you, and I feel like you landed on it.
I completely agree, because
profound,
you see...
I almost want you to say it again.
You see a lot of billionaires who die lonely, and you die miserable because you can't pay anybody to take that disease for you.
Thank you.
You know.
And you can't buy friendship.
Yeah, and then there's nobody coming to visit you in hospital. Or
so please say that again.
Yeah. For men out there, yes, you're successful in your career, you're successful in your craft, you're successful in your talent. But what's most important is what that talent does for you. How many people does it draw closer to you? So as you grow older, yes, maybe for younger men you can take that for granted, but as you grow older, from the age of 40, you want to start building your social network.
Okay.
The men who have a large social network live longer, have less stress, because if you're 80 years old and you have there's a famous picture that went through in the social media of about a class reunion of gentlemen who were together in the same class, I think 60, 70 years ago. Your people you were in nursery school, you are 70 years, the few people who are remaining, and you're still good friends.
Okay.
Yeah, I mean, when you're 70, you're retired. What activities will you be doing for fun? Are you getting me? You can't just be making money. You want to have
and a walk.
You want to have playmates to play golf or play chess, you know, or play the puzzle, or just sit and discuss and things like that. So your social worth actually is what is most important.
So invest in that for your health.
Invest in that for your old age, because by and large, your spouse, your wife, will be in her chamas all the time. That leaves you alone. So you also need to be busy with your men's group and men's things.
Okay. Thank you. Now, from you, the oncologist, I would like a hard-hitting fact on cancer in men in Kenya today. What can men do to stay healthy? What can we do as the women who love them to keep them healthy and with us for longer?
Yeah, cancer is real. It affects both men and women. So it's not just a disease of the women. We know 60% is in the women, but 40% occurs in men. And when they have symptoms, they should avoid persevering. They should go to hospital and get assistance. And also learn to speak to their friends, to their family, because a problem, if you say out your problem, it is half solved. Because somebody will say, I think I know, I can get you a doctor who can assist you because they assisted a friend or a relative. Yeah. But
So-
cancer is not a death sentence, and there's always hope.
So we give this thing away, the kujikaza kimwanaume. Is that the phrase?
Hiyo
Mwanaume ni kukaa
kujikaza.
ngumu. Yes,
Ati
we stop
mwanaume
that.
ni effort. Sio always effort. Like they're also vulnerable and they need love and they need support.
Okay, so maybe mwanaume ni kuongea.
I doubt.
Mike, do you have a hard-hitting fact on
No,
men's health?
I think everything has been said. I just like to encourage men to be able to, hold each other and walk. Be your brother's keeper. There's absolutely nothing wrong with you as a man being able to, check on your brothers, check on the people in your social circles. And like Dr. said, those are the people who will matter in the later years to come. Remember, we're still looking at some of your feedback. You can continue talking to us using the hashtag #TheLoopK24. But also, you can continue sending us your pictures, your videos, and your thoughts and opinions using the WhatsApp line, which is on the screen right now. I want to say thank you so much to the two doctors who have, graciously given us your time. Asanteni sana. And Valentine will be back with me next Friday right here on The Loop to have another conversation as we look at, take a bold look at our lives here in Kenya. Don't go too far, because up next on Unplugged, we have the talented Benjamin Webby, who's going to be talking to us about not only his music, he's got 3 albums under his belt, but he also met Akon. Aha, how many artists in Kenya do you think have done that? That's on Unplugged, coming up next. See you in a bit.